When I think back to the days I graduated medical school and what I wanted out of my career, it was always to do what was in my patient's best interest. Okay, so there are several ways to take the cataract out.
It was very important that Dr. Fitchman gave me the options, told me the various ways he could do the surgery. He left the choice up to me.
I keep thinking back to what's in my patient's best interest. So the thought of not acquiring a technology because it took a few extra minutes would have been unthinkable then, and it is now. This technology, the LenSx laser, I can assure you after years of doing this, a few extra minutes is well rewarded with the patient outcomes. And that's why I chose to adopt this technology. I'm Dr. Richard Fitchman, a community ophthalmologist in Manchester, Connecticut. In this video, I want to discuss the role and the integration of the femtosecond laser into my medical practice. I hope that this closer look at my cataract cases will be useful to surgeons who are either just starting their surgical journeys or to the more experienced surgeons as well. Keep looking at the black spot. By highlighting my techniques and the equipment that I utilize in my medical practice, I hope to encourage other surgeons to consider some of the advanced technologies and procedures that I have embraced.
This center, we're constantly introducing new things, trialing them, and giving the patients the best technology out there that we can give them.
When I look at my career in ophthalmology, I realize that I've seen and been at the forefront of many changes and advances in cataract surgery. Some of those have been evolutionary, others revolutionary. I have witnessed each of these innovations struggle to gain acceptance. In the end, the ophthalmic community has accepted and implemented them because they prove to be in the patient's best interest. So when I am asked to evaluate a new technique or technology, I always frame the discussion by asking myself the following two questions. Is it safer? Does it enhance patient outcomes? The answers to these questions help me decide whether to adopt a new technique or technology. Hi.
Hello.
How are you? Good. I wanted to talk to you today about your cataracts. Every decision I make in my approach to my cases also begins with a discussion with my patients preoperatively. During those discussions, I explain the many options available in modern cataract surgery. The same is true when I explain my adoption and use of the femtosecond laser. I explain the benefits and risks of all the parts of the procedure and highlight the enhanced security I achieve with the LenSx laser. And for patients with astigmatism, I explain how the laser can help to improve their visual outcomes with the possibility to reduce their need to wear glasses altogether.
Doing all right?
By explaining the benefits and safety that the LenSx laser provides, my patients understand that using advanced technologies helps us achieve the best possible outcomes.
Dr. Fitchman told me my options, what they were. He explains every choice he has. And he says, for your best interest, this is it, to do the best.
I find that patients are eager to invest in their health care once the benefits are clear to them.
Sometimes you go someplace, the last thing people want to tell you is how much this is going to cost you. And Dr. Fitchman was very upfront.
Any concerns I initially had about the laser integrating into our practice were dismissed right away. Our staff took to it almost immediately, and the ergonomics are fantastic, makes our procedures very smooth.
So nurses don't like change. All of us were concerned initially, how was this going to impede the workflow when we started to use the LenSx laser? Was it going to add a lot more time to our cases? Initially, we allotted more time as part of our training, and now we're down to, it probably just adds a couple of minutes extra. The procedure works very nicely into our workflow.
What's it say here?
It says we're going to take very good care of her.
Oh, we're going to take good care of you.
While some surgeons want the laser placed outside the operating room, we made the decision to put it in our operating room, and it makes the transition to phaco so much easier during the procedure. Although the docking procedure may seem awkward at first, here are some tips that I've developed over the years that may help you with your patients. When we are putting the patient on the stretcher, one of the things to remember is if it is a right eye, to skew the patient to the left, and that will allow the laser cone to be able to be centered over the right eye. Otherwise, in the midst of trying to dock, you'll have to move the patient at that point. I always think in terms of three things that can make the docking harder. One is if the eye is not parallel. I think of having actually a level on the dome of the cornea and having it parallel to the floor and ceiling. That will make not only for an easier dock, but also make sure that the information in the OCT is more accurate. There'll be no tilting in the OCT. Hence, the laser will deliver its power more uniformly. And the other thing that I think in terms of is the speculum. If the speculum is not wide enough, then it could very well be that that's going to hinder the docking. And the third thing, of course, is the most common, which is the nose. If the edge of the cone hits the nose, it'll prevent docking, and you just have to be aware of that. And actually, the last one would be the lateral canthus. Sometimes the dock looks great, and I just have to take a 4x4 and just pull the lateral canthus just the slightest bit, and that allows the docking to go very smoothly. And you can see that right here, that the eye is parallel to the floor. I'm now pulling the upper lid up because the upper lid lashes can get inside. And I look for a little meniscus. One of the things is you do not have to have 100% fluid wave. Once you get to about 60% fluid wave, you can ask for suction. And as you see, that works very well. The very first thing I do once I've docked is to look at the marks that I've made for the horizontal 180 0 meridian axis, and to adjust the laser to that so that any of our astigmatic keratotomies or wound placements are directly on the axis that we had intended. And you can see in this that the top line of the OCT is perfectly flat. That's what we're looking for. This is a very good dock, and you can see that the lens position underneath is perfect. There's no tilting. This is going to allow the capsule rhexis to be more accurate. It's also going to allow the energy to be delivered exactly where we want to deliver it in the fashion that we had intended. Also pay attention to make sure that the marker is right in the green, and so that everything is perfect as far as this OCT. Everything is flat, we're on axis, the marker is on the green, so we know that we're going to get a really good treatment here. These seem like small issues, but just one of them being off can really affect the function of the laser and the resultant treatment that we get. Once the LenSx portion of the case is completed, my staff transitions the patient under the microscope while I'm gowning for the start of the second part of the procedure.
Dr. Fitchman used the latest and greatest technology to get me where I want to be, which is no glasses, 20/20 vision. I am so happy.
I'm very happy with the operation. He told me everything is great. And I know it's great because I can see without glasses. I can read what he shows me. So Dr. Fitchman, thank you.
As you've seen, the LenSx laser has become an integral part of my surgical suite. And while no single technology can guarantee flawless patient outcomes, in my current practice, I found that by assembling the right combination of technology and equipment, along with a great staff, I can provide a positive surgical experience with patient outcomes that I could only dream of in the past. And that is truly exciting to me.